Treatment of esophageal cancer, part E, the operation. I'll split this video into two parts. One will be focused on your hospital stay and what happens after your hospital stay. And the second part of the video will be about the hospital operation procedure. Now, this video, I'm going to tell you what happens while you're in hospital and what's going to happen when you come out of the hospital. Obviously, I've not been through this yet, so if this information changes, I will make another video later. But what I'm to expect is, on the day of the operation, is an epidural. That's an injection into my spine, which will numb anything from my waist up. I'll be put under anaesthetic for 8 to 10 hours. That's how long the operation will last. The operation will be done with 2 surgeons and several other medical staff. I will also spend the first day on ICU, if there are no complications, and then move to a medium care ward. In there, there will be under a 24-hour observation period where the nurses can see your monitors 24 hours. Also in that week, you'll be given different fluids, from water, going up to tea, milk, yogurt, and every time you try these drinks, they will scan your body to make sure there are no leakages in your esophagus or in your new esophagus. And then if everything goes okay, you'll be moved to a normal care ward in the second week. Here you'll be taught how to eat other foods, walk around, do physical exercise, etc., etc. If there's no complications, you will go home. In the first 6 weeks, you will not be allowed to work. It will be total rest. With me, I will be getting a bed in my living room, and I'll also be getting a care from hospital workers or hospital carers that will come and help my wife, help me change anything that needs to be changed on my body. I've also been told there'll be about 9 lines going into my body or going out, to administer drugs, to administer food or water, to remove any fluids that may be building up in my body. Another thing was I will get an incision either in my right side of my neck or my left side of my neck. I will also receive an incision between my ribs on the right-hand side, and I will receive 4 keyhole surgeries in my abdomen. Yeah, that I will explain later when I do a video on the operation. So after the 6 weeks, they expect 6 months to a year recovery. I hope that's a lot quicker for me because I need to get back to work. And you're expected to lose about 10% of your body weight. So be careful that before you go into hospital, make sure you build your body weight up as